As you think about what your New Year's resolutions may be, the traditional healthy lifestyle resolutions probably still apply: eat healthier, exercise, get more sleep. However, after months of living with a pandemic and still facing COVID in 2022, what have we learned that we could add to that resolutions list? Well, Dr. Jeffrey Hatcher, Chief Medical Officer for Wesley Long Hospital, is sharing how to apply experiences from living with COVID this past year to your 2022 resolutions for a safe and healthy new year. All right, so Dr. Hatcher, we're going to go through a whole bunch of suggestions for how to do this. And let's just start with the first one, and that is how to battle head-on, COVID head-on, one-on-one.
Yeah, I think that the most important thing is to make sure that you're vaccinated and you've gotten your booster. And then for me, sort of personally and professionally, it's to make sure everybody who I have any influence over, to try to encourage them as much as I can to have had their booster and to try to do as much as they can to stay safe. So hand washing, wearing a mask, and social distancing, as we've known for a long time now.
But add that to this is what we're going to do. Okay, so this next one is all about, which kind of almost flies in the face of COVID, right? Because COVID kept us quarantined and kept us away, and sometimes still does, is about connecting with people more.
Yeah, I think you've said it really well, Mr. Rivera. I think that's really the tricky part about the pandemic, is that it's made us so apart from our friends. One of my really good friends at the start of this set up a monthly Zoom with all of our friends. And so when we weren't able to get together, we were always sort of checking in and touching base with each other. And it just came to mean so much to me. After a very short period of time, I was really grateful to him and to all my friends to be able to catch up like that. The other thing that I have done is a lot of outside exercise, and which can be social, and try to do your best you can to stay apart from each other while you're running or bike riding or whitewater kayaking or whatever it is you like to do. But it really is a great way to keep your fitness up and also to reconnect with folks.
Yeah, it's just good to be able to see somebody, even if it is through a screen. You know, it just helps you, instead of just hearing their voice, to see them. All right, the next thing you want to talk about is completing your advanced directives. So let's talk about, what does that mean?
To me, advanced directives means letting folks know what your preferences are about what you would like to happen if something bad were to happen to you. That is, if your health were to become suddenly worse and you weren't able to make your own decisions. It's really important. It's really hard to think about and really hard to talk about. Everybody struggles with it. Physicians struggle with talking to patients about it. People struggle with talking to their families about it. It's just very difficult, but it really is a tremendous gift that you can give to your family members, to let them know in advance what you'd like done and what your preferences are. I started doing this when I was very young. Some I consider very young, in my 30s, when I had kids. But it really is important. I really can't underestimate how important this is to your family members.
Yeah, it's kind of like the whole will thing, but it's also like, hey, if this happens, I want you to do this. Or if this happens, this is where the information that you need about banking information or whatever it is, wherever it is. And that helps relieve some stress for sure.
Absolutely.
All right, so let's talk about something that you think should be on all of our resolution list, and that is donating blood. Tell me why.
I love that, because I think it's really sort of the most noble things you can do. Is that it's really selfless, and it really saves so many lives. It really is a tremendous thing you can do for your community. The people that we partner with at Cone One Blood, all of our blood stays. Their sort of pitch is that all of the blood that you give in your community stays in your community. But I think giving at the Red Cross anywhere that you feel called to give, it's just a huge thing to do, and it's so important for everybody. And there's a huge shortage of blood right now.
And this was something that was brought up not too long ago when we did our own holiday blood drive, that there's a lot of things you can replicate, but blood is not one of them. That actually has to come from the source.
So far, that is true. Our level of science is not quite caught up to making our own blood yet, but yeah, it's so important.
And so that is one of those things where if you can give blood, then please do give blood. And if you've never given blood before, it's one of those things where you can make an appointment and you can go in on your own time, and you can do it when it fits into your schedule. You can do it so that you are not like maybe anxious at like a blood drive with a whole lot of other people. So that is a way to be able to do that. All right, so what we're going to do right now is we're going to take a quick break. We're going to be back with Dr. Hatcher in just a few minutes. We're going to finish going over some of those New Year's resolutions and maybe a few that you should add to your list. We're back with you with Dr. Jeffrey Hatcher, Chief Medical Officer for Wesley Long Hospital, and he's sharing ways to use experiences as part of your 2022 New Year's resolutions, especially in the midst of this pandemic. I know you wanted to make one more piece of information known to folks when it comes to blood donation.
I think that, one of my good friends, he had a group that he went with, and they donated blood every 6 weeks. And, I used to go and donate blood with a really good friend of mine. And I think it's a really good way to, one, make a commitment and have somebody help you stay accountable to it. And, a lot of people are afraid to give blood, quite honestly. And I am a little bit. And it's great to go with somebody who you're friends with, and you sort of support each other and sort of help each other out and watch each other thing. So it's a good way to do it.
Yep, you can talk about other things, keep your mind off it maybe a little bit, crack a few jokes. This is all good. All right, well, that leads us into the next one, which is be present and take each day one at a time. And sometimes that's been a little difficult, especially during the pandemic.
Yeah, I think that is really one of the tough things about being in the middle of a pandemic, is it can feel so overwhelming, and really for healthcare providers as well as anybody. But I think the trick is to sort of be present in the moment. What I tell myself a lot is, this is not forever. This is not going to be my forever life, and realize that there are other good things that are going on in your life and other great things that will happen in the future, and sort of just keep your eye looking forward.
Yeah, because the next day is going to happen anyway. So at least find one thing, if you can find one thing that day. Okay, how about this? Know your options for care. And I think that's interesting, because I think sometimes when we're unsure of anything, that leads to the stress.
Yeah, I think that's part of the idea of making sure you have a good primary care provider, a good doctor who can help you sort of navigate the system and navigate what your choices are, and what your needs are. And that's really important. I think that a lot of people struggle with that, whether it's reaching out to a friend or somebody they trust and getting a good referral for somebody who they think will be a good doctor for them. It can be tough to find a really good doctor. It's a tricky relationship. It's somebody you have to really trust and be available to. You need to be available to each other and make sure that you can share really personal information. And so that's super important, is finding somebody who fits that role in your life.
Okay, so a resolution, find someone that you can trust for your medical care. Now, if you don't have a primary care provider right now, what happens if you get sick? You're saying don't wait to schedule an appointment. Absolutely.
There are lots of great resources on the Cone website to go and find primary care physicians. Again, certainly you can reach out to people and will give you good recommendations. That's certainly something that a lot of my friends have leaned on me for, and I really appreciate it.
Okay, and last but not least, one that so many of us put on our resolutions every single year: have a fitness or exercise goal.
I love this because, I think the people who know me know that what I love to do is exercise. And I think the trick for exercise, and I tell this to my patients when they say they don't like doing it, I say, well, what do you like to do that's exercise? And really it's to find something that you enjoy doing and not make it feel like work. Find something you think is really fun. Sometimes it's being with friends who you're engaging in a similar activity, whether it's cycling or running, or again, kayaking, whitewater kayaking, or, whatever it is, Pilates, fitness classes, whatever it is that gets you motivated to be around other people and to reach your goals.
Even if it's just getting up playing cornhole on a Saturday afternoon, that at least gets your blood pumping a little bit. What happens for those folks who are in that cycle? And it's that cycle of, I know I need to work out and I really want to work out and I'm miserable not working out, but yet I just can't get myself out of bed to do that.
Yeah, I think for me, it revolves around, I've had some really good friends who've lost a bunch of weight this year through really committing themselves to that. And my question to them isn't really about how much weight have you lost, it's how do you feel? And so how does it feel to just sit on the couch all day, as opposed to going out and doing something which will affect your life in lots of different ways. It'll make you feel empowered by exercising. It'll give you sort of that endorphin high from exercising. It'll give you that sense that you're really doing something positive for yourself. And those are really great things that you can't get from sitting on the couch, quite honestly. And so, think about those things and think about how it's going to make you feel. That's the big difference for me.
I really do like that. How does it make you feel? Because sitting on the couch doesn't make me feel great. But getting up and doing something, even if it's just for 15 or 25 minutes, does make me feel better. I can even check something off my list that I did something good. So I understand that. Thanks for putting it that way. All right, Dr. Hatcher, thank you. If you missed any of this, you can find the information on our website, WFMYnews2.com.